Kathy. I've been here with Dr. Lipinski for about 2 months. So over the years, I've had just issues, just little aches and pains, neck pain, upper shoulder pain, back pain. I think two things probably really set it off. My career, I'm a dental hygienist, so there's lots of motion injuries related to that. And I was in a pretty serious car accident about 10 years ago, and that really spurred a lot of my symptoms. During that time, I've tried multiple things. I've done massages every month, once a month. I've done physical therapy. I actually had some radio ablation of some different joints in my neck. I've done other types of chiropractic, atlas orthogonal, which is designed to kind of treat your atlas. And I might have had some help in the beginning when the adjustments were first done, but it was never anything long-standing. So just in the last year or so, things seem to have gotten worse. I'm having more shoulder pain. I'm now having pain in my left hip. And I just decided I needed to try something different. I have a very good friend who's come to Dr. Lipinski for quite a while, and she's had good results. And all the things that she tried, she said this is the one thing that seemed to really help and really to be more long-lasting for her. So that's what brought me here. So the one thing that I really was impressed with is when you come for your initial appointment, Dr. Lipinski spends a long time just going over your symptoms, explaining what he's going to do, why it's beneficial, going over your health history. It was very, very complete. And then I decided to go ahead and proceed with treatment. We did x-rays, which they were easy, they were quick, totally painless. And when I came back for my consultation appointment to go over my results, it was amazing to me to see the x-rays and just see how, especially my neck, I'd lost my curvature. Some of the bony architecture looked different. I was getting bone spurs. It just made so much sense to why I was having pain. So I had my first adjustment, which it's really easy as a patient. I definitely think Dr. Lipinski is putting the work in on that adjustment, but it was painless, it was easy. I could notice a difference even after the first adjustment. The main thing that I noticed is on the right side of my head, in my ear area, I could just feel this warmth. It was almost like the blood vessels had been constricted, and just that adjustment had immediately opened that up, and I could just feel the warmth of the blood flowing. I noticed, I've been coming now for 2 months, and I've noticed that a lot of my symptoms gradually got better. I am no longer having hip pain. It's amazing to me. My shoulders feel better. My neck is so much better than it was, and it continues to stay that way. When I come back for my follow-ups, I'm staying in alignment. That's different than what I had experienced before, and I've noticed a significant decrease in my pain and my symptoms. It's really quite amazing. I think the main thing, I speak from a place of experience of a lot of different therapies, and I think there's a lot of things out there you can try. They can be helpful, and then maybe in the immediate term, but long term, it just makes so much sense when you understand what NUCCA is all about and what it treats. I mean, it's really important. I understand now how important it is to have that initial architecture of your spine, your neck in alignment. It does affect the whole rest of your body. It's so worth a try. Of all the things I've tried, this is the one thing that's really made a difference for me, and I just would highly encourage anyone to try and see how it works for you.